Hi, welcome to Case of the Day, and this is the 23rd case, 6th week, and the question here is axial spondyloarthropathy or DISH. So this 44-year-old presented with joint pain for 20 years, HLA-B 27 negative, and it's been progressing, and the patient has had variably been diagnosed to have an axial spondyloarthropathy. And then some have said no, and this came for an opinion this morning, and we can see these flowing osteophytes in the mid cervical spine indenting the esophagus. And I don't know if the patient has dysphagia. Um, and then we have these flowing osteophytes in the lumbar spine, the bridging about four vertebral bodies. There are enthesophytes on the acetabular margins, and you have this iliotransverse ossification, and then there are these calcaneal enthesophytes, both plantar and dorsal. And so we have flowing spinal osteophytes, extensive enthesophytes, and relatively normal SI joints. I actually forgot to show that the SI joints appear to be normal. There was an MRI done recently which shows these bridging anterior and superior and anterior SI joint osteophytes, but the joints are otherwise normal and there's no sacroilitis. And there was an MRI spine from 2018 where there was a screening study, and it shows progression of these bridging osteophytes or enthesophytes, and there's progression in the spine as well, especially at the L1-2 level. So is this DISH or is this axial spondyloarthropathy? And I did case 6 and I discussed sacroilitis and axial spondyloarthropathy and the protocol, and you'll find the link to that in the top right of this video, and I will also get the link at the end. But if you look at the classic Resnick's classification, it talked about these four contiguous vertebral bodies. And I did a fellowship with Don, and when I asked him later, many years later, why four, he said, oh, just because that's the best they could come up with. So it's not cast in stone. The disc shouldn't be involved and no sacroiliitis. And then Utzinger in 85 kind of made it into definite, probable, and DISH. But pretty much everything remains the same. It's just that you need to have flowing osteophytes in the spine and enthesophytes in other joints and normal discs and no sacroiliitis, and we're fine. Over and above that, there are these papers that describe SI joint changes in patient with DISH, and essentially there is no sacroiliitis, but you can have varying kinds of bridging osteophytes, anterior, posterior, fusion, etc. And so this is a characteristic pattern described in those papers where we have superior and anterior bridging osteophytes with otherwise normal SI joints. So in the setting of flowing spinal osteophytes, this actually adds to our ability to make the diagnosis of DISH. So here are those other enthesophytes that we see here. So please remember, DISH can occur in the young and progress. So this is a 44-year-old. Normally we see these in 60 and 70-year-olds. So it can occur, and it can be differentiated from axial spondyloarthropathy on the basis of the SI joint findings. Basically no sacroiliitis, and you may get bridging superior and anterior osteophytes. That's the WhatsApp channel. Thank you for viewing this, and you'll find the links to all the other videos here.